Arganissima, New York. Your exotic skin, hair, and beauty source, and your one-stop shop for all your natural and organic skin and hair care, featuring authentic organic Moroccan oil and prickly pear seed oil and much more. Bringing you only the best, straight from the source and proudly produced in the USA. So what are you waiting for? Shop today at www.arganissima.com. Arganissima, New York. Your beauty is our duty.
Hey, 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 it's me, Dr. Cheryl Bryant Bruce, MD, the Celebrity Doc, and you are here with us on Chatters That Matters. Let's talk about it. I'm here with my co-host, Hisham Elimati, Hurricane H, and our show is here to educate, inform, and entertain you. This is kind of a unique show in that this is a show that we are dedicating to a very special person in my life, my personal assistant who has been with me since 2005, DeWilda Brown, passed away on Wednesday of this week. So this show is dedicated to her memory, an absolutely amazing woman. And we send her off with much love. And on a happier note, today is my birthday, and I am just 21 with a few years of experience. So
happy birthday.
Happy birthday. Happy birthday.
Thank you. Thank you. And here on the bottom of the screen, we have a face that you may recognize. This is Dr. Miami. Welcome, Dr. Miami.
Cheryl, thank you for having me. Thank you, Hurricane, for having me. I'm excited to talk about plastic surgery.
Yay, absolutely. We're excited to have you here. Why don't we start out by you giving us a little bit of your background?
So I'm originally from New York, but I've been here in Miami since 1996. My wife and I met in college in Brooklyn when we were 18 years old, and now we're in our 50s. So it's been a while. I went to medical school in St. Louis, Missouri. She went to graduate school at University of Missouri, St. Louis. And after that, we had a difference of opinion. I wanted to train in Birmingham, Alabama. She said we should go to Miami. Lucky for her, I matched in Miami and never looked back because Dr. Birmingham wouldn't have the same cachet necessarily as Dr. Miami has. But we've been here since 96.
You're lucky to have gotten Miami.
Yeah, I'm lucky to have gotten her and lucky to have gotten Miami. Yes. So I've been here since then, and I do cosmetic surgery, mainly Mommy Makeovers. 95% of my patient base is women between the ages of 18 and 50.
Okay, so let's talk about that. What exactly is a mommy makeover? What does that entail?
So a mommy makeover is just a general term to describe any surgery or any cosmetic surgery that undoes the quote unquote ravages of childbirth. Okay, so as you know, and there's like 6 or 7 different combinations of potential mommy makeovers. Almost all of them begin though with the tummy tuck. Because when the uterus expands and the baby starts to grow, the muscles of the abdominal wall separate. And you can do as many sit-ups and crunches as you want and make them nice and strong. But if there's that separation between them, that weak area, then your abdominal contents push out. And no matter what you do, you'll have a little mommy pouch, especially when you exercise. Yeah.
This separation is different than the prune belly that we all get when we delivered the baby.
It's different. It's different. So there's the fat that, kind of sits there externally on the outside that you gain during pregnancy. And then there's the actual weakness of the muscle wall itself. We call it a diastasis, this separation of the muscles. And normally your abdominal muscles are strongly held together by fascia, by this, proteinaceous material that brings them together. So when you sit up and down, your abdominal contents stay behind it and flat. But once there's a separation, there's just like this weak, almost gossamer thin layer of tissue. And it's easy for the abdominal wall to push out and make it bow out. And the only way to correct that is to lift up the skin and sew the muscles together nice and tight, bring them back together. So that's usually the first step of a mommy makeover, is the tummy tuck. And all these operations I'm going to talk about can be combined or done in stages. But the tummy tuck, essentially, it's an incision low in the bikini line from hip to hip. The skin is lifted up, the muscles are sewn together, and then all the skin, the stretch mark skin, the fat, everything from the belly button down gets removed. And then the belly button gets brought out through a new hole in the center. It's your old belly button brought through a new hole.
Wow.
Yeah. And then we liposuction the sides to bring in the waist. Now, the second most common component of a mommy makeover is a breast lift or breast implants, because when you're during pregnancy, milk, whether you breastfeed or not, milk comes into the breast tissue and expands the breast. And then after the baby's born, or either if you breastfeed, obviously the breasts stay big for a while longer, but once you stop breastfeeding, the milk goes away and the breasts deflate. And usually there's left with extra skin, the areolas point downwards, everything kind of falls down. Now, if you're lucky, all you need is implants to reinflate that skin envelope. But sometimes the nipples have fallen too low, the breast, there's too much skin that's sagging. So you need a lift, and sometimes you need a lift with an implant. And that operation can be combined with the tummy tuck. And that's the most traditional classic mommy makeover, the tummy tuck with the breast lift with implants. Now you can also add Brazilian butt lifting, which is taking fat from the areas of the body you don't want them, and put it into the place you do want it, which is the butt. And what happens during pregnancy is the butt expands. The tissues get more, they lose elasticity. They sag down. What was on the top of the butt is now on the bottom. And so you reinflate the butt by moving the fat from those areas you don't want it to the area you do. Now, the butt lift is somewhat of a misnomer because we're not actually lifting the butt like we do with the breast. We actually cut out skin and lift. It's more of a reinflation, like a balloon that's been deflated, and then you blow it up and it gets nice and tight and round. And that's what the butt lift is. And of course, you can also add arm liposuction or arm lifts, thigh liposuction, thigh lifts into all combinations. And if you even want to do what we call a new body who dis, it's everything. It's a lower body lift, Brazilian butt lift, tummy tuck, breast lift with implants, arm lift, thigh lift. It takes about 6 hours and you walk out with basically a whole new body.
And nobody recognizes you.
Well, I mean, your face is the same. They recognize you. They're just like, wow, that vacation did you really good. Yeah.
Now, that's an interesting question, though. If you have all of this work on your body, you do this mommy makeover, and, now you're like, bam, 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 you have a banging body. We get that in our faces, too. So does that then require you to have to go and get face work done to match this body?
Sometimes yes, and sometimes no. It depends on the person. At some point after a certain age, you have to make sure that everything matches. Right. In the early years, in your 20s and 30s, no matter what you do to your body, the face kind of fits. But as we get older, things sag down here. You tighten everything in the bottom and you leave everything on the top, kind of showing his age. There's a little bit of a mismatch there. So yeah, I don't do facelifting, but it is something to consider in your 40s and 50s.
Perfect. Okay.
Yeah.
All right. So when can someone get a mommy makeover? Because clearly, immediately after you have a baby, everything's gone south, stretched out. You got prune belly and all of that.
So first and foremost, I like to wait till there's no milk coming out of the breast. That's a good rule of thumb. So for some people, it's 3 months. For some people, it's 6 months. If you're breastfeeding, I would wait. Assuming you want to do something to the breast. If you just want to do something with the tummy or the butt, you don't have, the breasts are kind of not part of it. It doesn't really matter. But in general, you want to wait at least 3 months after giving birth before you do it. I'm not a big fan. There was a trend in the 90s of celebrities that would deliver via C-section or, they have their baby and then immediately do a tummy tuck at the same time. Mm-hmm. That's not a smart idea. I don't think you should ever combine any plastic surgery with any operation that involves internal organs.
Okay.
And people did it a lot more often, I think, in the 90s when I first went into practice. And now I think it's generally considered unwise, because as you know, when you go internal into the abdominal cavity, there's a lot more things that can go wrong.
Right.
And a lot more serious things that can go wrong. And if you do something on the outside, you do a tummy tuck, you do liposuction, it's very hard for the surgeons to follow the progress of the patient if something goes wrong internally. Because when you do liposuction or a tummy tuck, your tummy hurts. Right. But if you do, let's say, a hernia repair or a colon resection or a hysterectomy or a C-section, and there's something wrong internally, you've nicked an artery you shouldn't have, or somebody got an enterotomy, you went into the bowels or something, they're going to have abdominal pain, but they're expected to have abdominal pain anyway from the tummy tuck, and you're not going to know, and that could delay treatment. So yeah, that's my take on combining those two. So you definitely want to wait a couple of months, at least 3 months after giving birth, before you consider having a mommy makeover, in my opinion.
Right. Now, we see a lot of shows out there like Botched. Where do people get into trouble with plastic surgery?
So look, there's a lot of ways to get into trouble. It's like driving, it's like driving. Is driving safe? Is it? Yeah. If the person driving is sober and knows what they're doing and is careful and everything else, it's perfectly safe. But you wouldn't get behind the wheel, or you wouldn't go into a car with somebody drunk behind the wheel, or doesn't know where they're going, or is distracted playing on their phone or something. So that's how I would categorize all of surgery in general. The risks are very dependent on the person who's doing it. Now,
right.
There's two categories of botched, right? There's botched where the surgeon clearly made a mistake. He should have zigged, and instead he zagged.
Okay.
I'll call those the true botches. Then there's what we just call unfavorable results, where the surgeon did everything right, and the patient maybe did everything right, but things did not go the way they usually go. There was an infection. There was I remember a woman who I did a nose job on in 2003, and she was leaving the hotel, and she was trying to put her bags into the trunk of the car, and the cab driver was trying to help her, and they were fighting a little bit, and he elbowed her right in the nose, broke her nose. I mean, a week after plastic surgery. Had to go back to surgery, fix it. Things happen. Okay. Now, is that botched? No, it's not botched. But obviously, it wouldn't look the way she wanted it to look, because it's been broken twice. Okay, so there are those things that happen, and those are unfavorable results, and it's hard to tell sometimes which is which without knowing the whole story.
Right.
And knowing so. Obviously, every patient has to be their own best advocate post-op. They have to follow all the doctor's instructions. They have to take care of themselves. Liposuction is not a miracle. Neither is a tummy tuck. It doesn't mean you can never gain weight again. A lot of patients,
let's talk about that a little bit.
Yeah, 5 years later, patients are like, I thought I would never get fat. What made you think you'd never get fat again? I mean, if you eat, the fat's going to go somewhere. The calories go somewhere.
Right. And I want to talk about that, because I had a friend who, she got her tummy tuck. The tummy was beautiful, and she didn't modify the lifestyle appropriately. And she developed big wings because, she didn't have the fat cells in the tummy, but it has to go someplace, right?
That's exactly right. That's exactly right. So, what people need to know is that the number of fat cells in your body is more or less fixed by the time you're 4 or 5 years old. Your body doesn't generally make new fat cells. It just kind of uses the old one to store fat, Now, each fat cell, although it's microscopic to start off with, can store enormous amounts of fat, to the point where very obese patients, their fat cells are visible with the naked eye without a microscope. Those cells can grow that big. Right. So let's say you have in your stomach, you might have 4 or 5 million fat cells in your abdomen and your flanks. With liposuction, we don't remove all the fat cells. It's impossible. At most, we can remove maybe 50%, which is significant. But now that you have 50% less fat cells in your tummy and your sides, when you eat and those calories, get broken down into fat in your bloodstream, that fat's going to be absorbed, sort of proportionally through all your fat cells. So if you have more fat cells, proportionally speaking, left in your arms and your back or your face or your fingers, that's where it's going to go. And I've had patients that have had liposuction, years ago in everywhere, abdomen, flanks, back, chin, and they get fat in weird places, their shoulders, their earlobes, their face, because, the fat gets what it wants. It's going to go somewhere. There's no way around that. So every plastic surgeon and every plastic surgery patient should know that lifestyle changes and maintenance are critical to maintaining a result. You're spending all this money, all this time, all this pain. You need to know that. And you need to it's a team effort. The surgeon just does their part and the patient has to do their part as well.
Now let's talk about some of that maintenance, because people go and they get this plastic surgery and they have this beautiful, youthful looking body, but time marches on, and so does the aging process.
Gravity too.
Exactly.
Unless you sleep upside down like a bat, which would be great, but we don't.
Right.
Yeah, I mean, gravity and time and age, it marches on, and people. I mean, I think people with common sense understand that, but you need to know that plastic surgery is not a one and done for most people. It requires maintenance from yourself, and then also most commonly maintenance from the surgeon, maybe 10 or 15 years later. And one of the secrets of Hollywood stars is that they nip and tuck and they tuck and they tuck and they tuck. They go back every 2 or 3 years to maintain. Sometimes to an extreme degree. I think Madonna is an example of maybe one tuck too far, but but it worked pretty well, through her 50s and 60s.
For a long time.
It worked really well. But that's the secret. It's not that she did a facelift in her 40s, one facelift. She did one in her 40s and one at 45 and then 50 and 55. And by the way, I'm not her doctor, so I'm just surmising.
After people have had a lot of refreshes and nips and tucks, a lot of people start to get this cat-like appearance. Yeah. And then there's Martha Stewart. How the heck is that happening?
Yeah, I don't. And Jane Fonda, I don't know.
Yeah. Well, Jane Fonda looks really good. I saw her a few years back, and she looked really good. But I mean, Martha Stewart is ancient.
Yeah, I don't know. I don't know. I'm not going to say she drinks the blood of children, but it's possible. No. I listen. Everyone has their secrets. I don't know. Yeah. I'm assuming it's just good plastic surgery and that's maintained appropriately.
Yeah.
That's it. Like I said before, I don't think this is something everybody should do. But if your job involves being in the public eye, if you're an actress, if you're on TV, if your livelihood depends on looking a certain way, I think it makes sense. I think for the average person to go back for a little nip and a little tuck every 2 years, I'm not sure the risks and benefits are in their favor necessarily,
Right.
Yeah.
Right. And it's not inexpensive either for the average person to do this. I mean, if your job is dependent on you having a certain look, then it's worth that investment. And chances are you're in a job that's going to pay you well for having that look.
Right.
But the average person isn't that.
The average person isn't that. And I think as you get older, it gets riskier.
Yeah.
I mean, that's another thing that people need to understand, For example, the operations that I do, the mommy makeovers that I do are extremely taxing on the body, on the cardiovascular system. There's fluid shifts on the kidney. I don't do mommy makeovers in my practice on people over the age of 50. I just don't.
Say that again for the back of the room.
Yeah, so I don't do mommy makeovers on people over the age of 50 because in my experience, the operations themselves are just too taxing on the body. Now, that's not to say that other surgeons won't do it or that it can't be done. Of course it can be done. But after 50, there's many people with occult cardiac disease that they don't know. But we all know people out of the blue in their 50s, they have a heart attack.
Mm-hmm.
They look like they're in great shape. Pre-op EKG wouldn't pick up on it. You're not going to get echoes and angiograms on every person you're going to operate on pre-op. And again, knowing that this is like the ultimate stress test, I don't do those operations on patients over 50. Now, you can do it. And I think other operations are fine. You know, eyelids, facelifts, rhinoplasties.
Mm-hmm.
Sorry, things that are not as intense, I think, are fine.
Mm-hmm.
You can do facelifts in your 90s, assuming you're healthy. You know, sometimes those operations are done awake under local anesthesia. You know,
okay.
Those are not bad. There's very, very little blood loss. But when you're talking a tummy tuck, you're talking a Brazilian butt lift or even a breast lift, the blood loss is significant. The operations take hours. It's general anesthesia. You need to be careful. It's not worth losing your life for.
Right. And I mean, you know, we know of some people who have lost their lives. I mean, I remember a number of years back, Kanye West's mother, that was all in the news.
No. And you know, her story is a good lesson for all of us because she wanted the surgery so bad, and many plastic surgeons turned her away because of her pre-existing conditions. And, you know, doctors wouldn't clear her. I mean, if you want to bad enough, you'll find some surgeon somewhere that will do it.
Yes.
But you have to be your own best advocate, and you have to really understand the risks of surgery, you know?
Right.
It's really for healthy young people, you know, those kinds of surgeries, the big surgeries we're talking about.
Right. Now, even with a healthy young person, there's a risk. And let's talk about the risk of people going for these, what do they call them? Tourism vacations. You know, a lot of times they'll go down to Mexico to get this work done. Talk about the risk of that.
So there's two risks. The first risk is the risk of travel. So if you go to a foreign country, and we saw that tragic case last week of the young lady that went down to Mexico and just took a wrong turn, you know. And although that can happen anywhere, it happens more frequently in countries that are less well policed, let's say. And the other thing is, you don't know the language. If you go to a country where you don't know the language and something goes wrong, you know, how you're going to interact with the hospital staff or the emergency services and things like that. So those are things people don't consider until it's too late. Now, there are great surgeons in every country. There are great surgeons in Mexico, great surgeons in the DR, great surgeons in Brazil and Venezuela, Colombia, Turkey. Okay. However, how are you going to know who the great surgeons are in those other countries if you don't speak the language, if you don't live there, if you don't have the way to vet them other than just one page on a website, you know? Right. So, you know, so those are the things that people don't consider. Okay. However, I mean, if you are from that country and you can properly vet and research the surgeon, let's say in the DR or Colombia or Mexico, and you have family there, you know what's going on, they can be there for you, or you speak the language, I think it's fine to travel. If it's a better deal, why not? But for most people, when they travel, they go in with very little information. And many, many women have lost their lives, dozens in the DR, in Mexico, in other countries, in Turkey. You know, I mean, it can happen in America, it can happen anywhere, but if it happens someplace else and you're out of the country, a small problem can become a big problem very quickly.
Right. And I think one of the big things that people really need to do, you used to do it anyway. Like you said, there's a vetting process. But if you're going to have a surgery in another country, part of that vetting process should be getting a thorough look at the facility. Ask to see the
Yes.
operating rooms, ask to
Yes.
see the recovery areas, ask to see
Yes.
the room that you're going to be staying in, because while the waiting room might be pristine and lovely, the back might not be so much, and you're not going to know that.
That's where the rubber meets the road. It's in the operating room and in the recovery. The
Exactly.
other thing, people do not pay enough attention to the recovery process and what
Hmm.
happens from the moment you leave the operating room to the moment you head back home. And that a lot of times is where things go sideways. Whether it's in the recovery room, getting too much pain medication and stopping, God forbid, stopping your respiratory centers. You
Right.
stop breathing and no one's paying attention.
Right. And that
And
happens
then
often, because I used to
happens,
work at Foundation Surgical Hospital as the emergency room doctor. I was a concierge physician there. And so I would be on for like 10 days at a time. And I pretty much every night on a regular basis, I would get awakened
yeah,
because somebody had had a little bit too much anesthesia and they
yeah,
came back from recovery. They thought they were looking pretty good. And now we're doing a respiratory code on them.
yes,
And I
yep,
think it's
yep,
probably safe to say
yep,
that most of the losses that
yep,
occur from surgeries actually occur from the post-op experience as
yeah,
opposed to the
yep,
actual surgery
yep,
itself.
yep. I agree. At least half happened in that perioperative period,
Hmm.
and sometimes it's just a question of having too many patients for too few nurses, or
Hmm.
or sometimes surgeons or the staff is being rushed. A lot of, if you're in a busy hospital or a busy surgery center, they're turning over the room, they're not paying attention, trying to get the next case going, and then it only takes 2 or 3 minutes of not breathing for your sats to drop and for you to get into serious respiratory trouble. So that is key. My practice is very boutique-ish. I have one operating room, one recovery room, one-to-one nursing, one-to-one surgeons. It's not a
Right,
factory. And
right.
my patients, and this is not an ad for my practice, I'm just telling you how I do it. My patients go directly, from the recovery room once they're stable, transported to a hotel where all my patients stay on the same floor. I have nurses there 24/7 to watch them.
Right.
Most plastic surgeons, whether in the US or other places, they'll send patients home.
Hmm.
And then if their family member's not a nurse, they kind of become a nurse, that first day or two. And
Hmm.
I don't think that's ideal. Um,
So how long do you recover them at the hotel?
so it depends on, for a typical mommy makeover, I have them stay a whole week where I can watch them, visit them there,
Right.
make sure they're okay, etc. And a lot of patients come alone. They leave it's great because they leave their kids and their husband has to deal with the kids and they just kind of relax. And I've got
Right.
ladies there to massage them and bathe them and
Oh,
baby them and
nice.
ultrasound them, whatever they need. So
I don't
that's,
even need a mommy makeover and I want to come.
it's a nice excuse to get away, and
Yeah.
it's in Miami. It's right on the water. It's a real nice neighborhood. So that's how I think. And there are other surgeons that do similar things, but I think when you go to another country, and I mean, I've heard horror stories. We all have heard horror stories where patients, that they'll have to find their own Airbnb, someplace to stay.
Yeah.
Who knows how clean it is or what's going. No one's going to watch them there.
Right.
Some
Right.
countries require you, hospitals, or they require you to buy your own medications. Like you go across the street to the drugstore, buy the bags and then bring them to the clinic. I mean, it's a completely different setup than we have here in the States and many other countries. So be careful.
Yes, it is. Yes, it is.
So,
Now, let's talk
so,
about
so
surgeries that
doctor, is that
have gone surgeries that have gone wrong, and the somebody comes to you and you're not the original surgeon.
Right.
Do you do those repairs, and why or why not?
So I do sometimes. It depends on the case. So
Hmm.
if it's not my specialty. There are surgeons that specialize, like the botch doctors. There are surgeons that specialize in
Hmm.
correcting surgery that went wrong, whether
Hmm.
it was botched or, like I said, unfavorable result, not botched, but just didn't come out the way they wanted it to. And those surgeons get very good at fixing the same kinds of problems day in, day out. I don't do that day in, day out, but occasionally I'll see something that's interesting to me, that's unusual enough that if I think I can help them, I'll take it on as a challenge. But in general, it's not my bread and butter, so to speak. It's not something I do every single day.
Hurricane, you had a question.
Yeah, sorry.
I'm listening to you guys, doctors, and no worries. You were talking about all the different procedures and also the risk and everything. But I'm on the insurance space, so obviously we're the payers, and I know it's not usually covered under the insurance world.
Oh.
But the idea is that for obvious reasons, right? But
although in Brazil, they do have free plastic surgery in Brazil.
They have free plastic surgery in Brazil?
Oh,
yeah.
So you can go to Brazil to get your BBL?
No. You have to be Brazilian. I'm saying their insurance system, their healthcare system does cover some types of plastic surgery. It's like why shouldn't the poor be as beautiful as the rich? Is the philosophy down there? So
now, is there ever a time that you do accept plastic insurance?
No, I don't accept any insurance. No.
And Hurricane, because you're on the other end of things, is there a time that insurances will cover plastic surgery?
If medically necessary only. So if there is something that's happening where and we've had case by case where it proved to do a procedure that may have some cosmetic aspect to it, but it's to rectify a medical condition. And we've had for breast surgery that happened. We've had some cases with the body and other parts. Accidents do happen also, and sometimes you need to repair, restore, like that. Case by case, and again, it depends on the insurance. It depends what program, and it's not I just want it and pre-auths and all the stuff as else. And again, you have the party that's going to do it. I mean, as you stock, you don't do it yourself, but in some hospitals they would do it. That's the process. But the cost is in general what's the inhibitor factor in general in terms of access, and I think that's one of the problems where people do choose. For example, in the U.S., it's more expensive, let's say, than in Mexico or in Central America, and people to go the cheaper route, and then the results are not as ideal. I mean, and unfortunately now I can't speak to the cost of it. I mean, obviously, it was more expensive in the onset of it. I think in the 90s, just like for the elite, you want whatever you call it, but then now it's more accessible. But what would be that cost for people just to comparison? People thinks, well, I'm gonna be better off going to Turkey, but then you still have to fly, you still have to do this and then the other. When you add it up, is it worth it? And the risk you take?
Right. So again, it depends on the person. But like, for example, Miami hands down has the best prices in the country for plastic surgery. Like it can be sometimes a third of the cost of what they charge in New York for the same operations by better surgeons. So as a travel destination for plastic surgery,
Miami.
there's nothing.
And all the New York surgeons just got managed.
But it's true. That's just the truth. So and same thing with LA. I mean, the surgeons in LA charge what would be considered exorbitant prices for the same work with the quality. I don't know. You'd have to go on a case by case basis, but the prices are much more expensive in California and New York. Texas is somewhere in between. But even the prices in Miami, they can sometimes be half the price in the DR or Turkey. Right. So, yes, there's airfare involved and there's added risks and everything else. But if that's all the money you have and you really want it, it's your only option. I would caution against that. I would say better to save or finance and do it safer and be less risky with your life. But that's not how everybody thinks. Like I don't ride motorcycles, but a lot of people do. And it's just a question of your own risk benefit tolerance.
Yes, absolutely.
Pretty
Now,
powerful.
Hurricane, again, a question for you. We're talking about insurance covering these types of procedures. Say, for example, a woman has a mastectomy and we're talking about a breast reconstruct after a breast cancer. Are those typically covered by insurance?
Probably gonna say no. I
Okay.
have not seen one that's been, that's been covered, at least in my world, because I'm not in the commercial space, in the government program, which basically they cover the minimum, if you want to call it that way. It's not really extra. I mean, you policy have the additional pieces and override and everything, and you get extra stuff, but not in the world that I'm in. It's really the Medicare and the Medicaid space and managed care. It's very restrictive, and again, it's audience that for the seniors, they're not going to do like that for, I guess, one the cosmetic, aspect of it. So I haven't seen any, but I've seen, cases of younger folks, for after pregnancies and so on, or some intervention that needed some, access, and some of that was done. I've seen accidents where that was all authorized to actually fix, facial, pieces of parts, and even some body parts. But those are like, again, case by case, authorization only. We have medical staff that's usually in on any of the companies or the HMOs, or any insurance company, and those are the ones that determine those cases. And if it has merit, I mean, again, it doesn't hurt to find out. That's the other thing. People don't do
Right.
that. They just think it's not covered. You don't know. If your primary doctor knows that this is going to help, can document enough reason why you need this, could be acceptable and it could be approved. But many people don't. And you can also appeal a case if you're not sure and you think that it's a mandatory or must. So these are all questions that are still remain. And again, insurance is always kind of weird when it comes to those things, cost. And so it has to be well justified and has to be within their norms, and whether it also varies on the staff. You might get a doctor that is on the medical staff that will believe that we want this to be healthy because it's going to be more efficacious in the long term, and for this surgery going to prevent all the bad stuff to happen longer, which costs longer, term.
Right.
So that could be also an aspect of it. But again, a medical doctor from an insurance perspective, will probably give more details on that. But from our world, typically that's maybe a 1% or a very small minute percentage.
And I think that it's important for people to understand that even if insurance will cover a surgery, most plastic surgeons do not take
Take
insurance. So
insurance.
you may have to pay out of pocket and be reimbursed for
Right.
that
Right.
surgery. You might as well just kind of expect that a plastic surgeon is not going to take your insurance. Now, one of the questions that I'm sure a lot of people have is, when we're talking about getting these surgeries, talking about scarring, how frequently do you do these surgeries laparoscopically so that the scars are minimal?
So I don't do any laparoscopic surgery because almost all the surgeries that I do are not appropriate for laparoscopy. Is not appropriate for it. So, for example, if I'm cutting out a giant skin flap from someone's tummy, either from weight loss or pregnancy, the only way to
Right.
do it is to cut it out. There's no way to do that laparoscopically. Now, the liposuction is done through tiny incisions like the size of a staple. So those incisions are essentially smaller even than laparoscopic instrument incisions. They're really, really small. But a breast lift, I mean, you need to move the nipple up. You have to make incisions around the areola, down the middle, underneath. There are significant scars. Now, everybody heals differently.
Mm-hmm.
And even the same person, one side or one part of the scar could heal better than another part of the scar.
Right.
So, and before you consider any plastic surgery, you need to look at before and after pictures of exactly where the scars are going to go. You need to be prepared for those, again, with the exception of liposuction, because those are tiny. But if you're considering a breast lift, considering a tummy tuck, a lower body lift, an arm lift, a thigh lift, you need to look at the scars. You need to look at your own scarring history. If you're keloid, if when you pierced your ear, you had a keloid scar, it's probably not a good idea to do a breast lift, because if you're keloid there, you're not going to be so happy.
Right.
But, with that said, after the surgery, starting at about a month after the surgery, there's a scar treatment regimen that I recommend to patients. It usually involves silicone tape and some scar creams. You put them on every day. Scars tend to stay flat, tend to lighten with time, and they fade with time, but they never disappear. Once a scar is on your body, it's there forever.
Right. Right. And I know that a lot of people come in and ask about scar revisions.
Yes.
how do you feel about a scar revision? If they've had a scar before, is a scar revision likely to be successful?
So about 50% of the people that come in for scar revisions, their scar is as flat and as good as it could possibly be. There's no way to erase it. The other 50%, the scar is either hypertrophic, keloid, it didn't heal well. In those cases, it's worth it because most of the time you'll get a scar that's better. Okay. And better is better. Even if you can't make it go away, if it's less conspicuous, you can move it to a place that's easily covered, or you can make it thinner or flatter. It's worth doing.
Okay, perfect. Hurricane. Now, I can't see the feed. Are there any questions coming in from the feed that our guest might want to have answers to?
No, there was one comment I would hear. It's actually about
your 21st birthday.
Birthday today.
Thank you so much. Thank you so much. I am going to get myself dressed up and take myself out to a very nice dinner over in the Doco area. The Golden One Arena is over there. Go Kings, light the beam. We're on a roll.
Enjoy. Well, listen, thank you for having me on the show today. I really appreciate it. I really do.
Thank you for joining us. That was very interesting and a couple of those questions I've been carrying around for a while now. So I was glad to get them answered, and I'm sure that our audience was happy to get some of those things answered as well. So if there is one or two takeaway points that you absolutely want the audience to take away from this, what would those be?
I think the first thing I think is safety first. There's no plastic surgery that's worth losing your life over. So the most important thing that you should consider before price, before even the quality of the results, is the safety of the surgeon and the location you're going to have your surgery. That's the first thing. Second thing is that plastic surgery is a team sport. That means the patient themselves is the player and the surgeon is the coach. You have to maintain the results. You have to prep yourself before the surgery. You have to take care of your wounds and your healing process afterwards. You have to maintain the results to be happy.
And I'm going to toss one thing in on that, taking care of yourself. The best way to heal from any surgery is to have a good diet so that your body is nutritionally sound enough to have good building blocks.
Yes, that's true. You are what you eat. You are what you eat.
Absolutely. Well, Dr. Miami, thank you so much for joining us, and thank you for making the world more beautiful for all of the mommies.
Thank you.
Because it definitely it is a self-esteem thing when you can get that body to snap back, whether it does it naturally, which it doesn't often.
When you feel better about your body,
surgical help.
When you feel better about your body, when you change the way you see yourself, you can change your whole life. So.
Absolutely. So thank you for what you do. And we've enjoyed having you, and we hope that you'll come back and see us again.
Thanks, Cheryl, and happy birthday again. Thanks, Hurricane, for having me on. Have a great and blessed Sunday.